The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. So you've gotten vaccinated, boosted, masked, and socially distanced. Still, the coronavirus found you. So why is it when people do everything they can to avoid the virus, they still get infected? In this episode of Medical Minutes, I speak with Dr. Christopher Doehring, Vice President of Medical Affairs at Franciscan Health, who explains. We also discuss if it's possible to get Omicron twice. Our conversation is next. Okay, all right. So a couple things for you, Dr. Doehring. Always love having you on, but I have this, pressing question.
Okay.
This is happening to people. It's a sort of like a burning question. You've done everything you can to avoid infection. You've gotten your vaccine, you've gotten boosted, you've social distanced, masked. Why am I infected? Why did I get infected?
Yeah, that's a great question. And certainly with this Omicron variant being so highly contagious, it can even overcome doing all the right things. And unfortunately, a lot of people have the virus and don't realize it. And so then they can spread it to someone who thought they were doing all the right things. But even so, we're vulnerable to actually getting the infection. The good news, as we've talked about all along, is even when folks like that get infected, they still maintain incredibly high protection against severe illness, hospitalization, and death, upwards of 90+% protection against those things. And so, I know it's discouraging. It's like, dang it, what more could I have done? But the good news is for the vast majority of folks in that scenario, they're going to have a mild illness, recover without incident.
Right. So it sounds like, you can save lives with all of these things, but you cannot prevent Omicron. At least for now, this is what is happening in the US and the world.
Yeah, for sure.
Mm-hmm. And then, I'm thinking like it's Omicron's transmissibility, and then it's able to evade the vaccine. But also, if you've had the vaccine, the booster, previous infection, this is sort of like the triple sort of protection against the variant. So it's just very curious to me. Yeah.
Folks in that camp are much better protected even from just getting Omicron. And so having that level of sort of triple protection, again, it's not 100% protective, but much more protective even from just getting mild illness. So, a lot of different scenarios that are playing out here. People who've been vaccinated, which vaccine did they use? How long has it been? Have they been boosted? Did they get an infection 3 months ago? Have they just had an infection in the last 3 weeks? I mean, there's so many different variables that drive what level of protection you have and how well it protects you against Omicron.
Right. There are a lot of variables that can contribute to
right.
Why this might happen. So is there anyone who's, speaking of that, maybe we can't narrow it down to a specific group, but is there a population you would say who was most vulnerable despite doing everything they could in the time frame that they could?
Yeah.
Who is most vulnerable to this infection?
That's a great question. Yeah. And certainly there are super high risk populations that we get concerned about, particularly those who are immunocompromised, those who've had organ transplants, bone marrow transplants, even older folks who are, over the age of 75 or higher. Their immune system may not be as robust. And so there are some increased risks in those populations for having reinfections or having these other efforts fail them.
Should a person be concerned if they get infected with this? I feel like, I was just speaking to a woman this morning and she was like, I'm so afraid, I've done this, I've done that. I'm trying to do everything I can, but I'm so afraid of, maybe I'm asymptomatic, spreading it to someone else. Can we put some sort of, I don't know,
people's minds at ease a little bit?
Yes, yes.
Yeah. I think the good news on the Omicron front is that we are seeing a relatively milder illness with it. I think just because it's breaking through all these different efforts that we're making doesn't mean those efforts aren't worth it, because there is still some risk that you could have a severe illness, or you could spread it to someone who could have a severe illness or fatal outcome. But in terms of putting people's minds at ease, it does seem to be much less severe infection this time around, and we have more treatment options at our disposal if someone is really high risk and needs to avail themselves of those.
No, that's wonderful. All these sort of treatments and therapeutics are coming out at this time. So what do you recommend for someone? I mean, Dr. Fauci said this is inevitable. Everyone's going to get this Omicron.
Yeah, I mean, I think especially as it relates to being around others and going into enclosed places with a lot of other people around, it's a really hard thing to avoid. If someone brings it into your household, one of your children or a relative or close friend brings it into your household, it's hard to avoid getting it. Now, is that a fatalistic comment that it's inevitable? A lot of people are getting it. Maybe most people will get it, but everyone won't get it. And so anyway, it is still worth making those efforts, trying to do what you can to avoid it if at all possible.
Sure. Sort of like a sweeping statement there. So we don't know yet, unless we can count everybody in the United States and the world.
Right.
So what would you tell the person who says, I've done everything, I give up? It's, it is inevitable.
Yeah. I mean, I think a lot of those debates go back to how long are we going to need to be masking? How long are we going to need to worry about distancing? How long will we need to have restrictions on how many people can be in an enclosed space? All those types of things. I think as long as this virus is continuing to have a level of severity that's significantly higher than influenza or some of the other viruses that we see on a regular basis, we're going to need to be vigilant about it. And so developing that persistence, developing that resilience in terms of, hey, we'll do what we need to do to be as safe as we can be, and to limit the deadly outcomes of this. We'll need to stay in this fight together and do what needs to be done.
Right. Keep on keeping on. Well, always great. Always great. Insight from you. This is going to help a lot of people. So next question is here. Is it possible to get infected with Omicron, considering its dominant strain now, twice? And if so, why?
Yeah, that's another really good question. Generally speaking, especially as short of a time frame as Omicron's been around, we're not yet seeing reinfections with Omicron. Because that transition happened so quickly from Delta to Omicron, we are definitely seeing people who were sick a month or less ago getting another infection. And so that speaks to, well, you probably had Delta as it was on the way out, and now you've got Omicron now that it's dominating. And we definitely have seen that play out. For someone to be reinfected with Omicron or the same strain, it usually takes several months for that immunity to wane to the point where you'd be susceptible again. Not impossible. Again, some of those immunocompromised populations might be more vulnerable on that front, but for the vast majority of us, once you've had it, it's unlikely that you'll get it again anytime in the next 3 months or so.
That was sort of my next question, Dr. Doehring, who might be most vulnerable to this, and again, why? I mean, we say immunocompromised, but can we put some labels to immunocompromised? Sure. And I think that it's sort of become like a phrase where, it's in one ear, out the other.
I think some of the most common, and these are significant populations. I mean, we've got a lot of cancer survivors who are still on chemotherapy regimens, and that in a lot of cases can suppress their immunity. We have a lot of solid organ transplant survivors who take low levels of immunosuppressing drugs every day. Those folks oftentimes are more vulnerable. Same thing for bone marrow transplant survivors. We have a lot of therapies, a lot of things we've done to cure or treat other diseases, but that can knock down your own body's immunity, that can make you vulnerable, and so makes you less of a protection from vaccines. It could also make you more vulnerable to reinfection in a shorter period of time.
Yeah. So just going back to what you said previously, it's most likely someone was infected with Delta, and then if they got reinfected, it was Omicron.
Yeah, it's not. Right. Again, we've seen scenarios where back in early December, somebody had COVID. Here again in mid-January, they got COVID again. We're like, what the heck is going on? And most likely they were infected with Delta 4 or 5 weeks ago. And now here Omicron comes along and they get that as well. And it's not unlike, somebody who says, gosh, that seems like I get a cold every other month. Well, it's not the same cold virus that's getting them. It's a different virus that's getting them. But indeed, they are getting a cold, every month during the winter type thing. So it's sort of along those lines.
It's a different strain. That's so interesting. And what would I think that sort of trifecta, from what I understand in terms of sort of following the science, is you get your vaccine, you get your booster. If you have also sort of that immunity after being infected, that's sort of like the trifecta. If getting infected twice, would that sort of enhance even more antibodies, or do we not even know that yet?
Yeah, I think that one's a little tougher question to answer at this point. But indeed, to your point, getting a primary vaccine, getting a booster, having an infection despite those things at some point does stimulate different parts of your body's immunity and creates a more robust immune protection. So yeah, that's the, like you say, trifecta that can lead to almost super immunity, at least for, some period of time, probably 3 to 6 months at least.
Mm-hmm. Okay. Well, that's good news.
Personally, I fall into that category. I was fully vaccinated, had COVID as a breakthrough about 7 months later. Now both of my kids have been home and from college and have gotten COVID. And so I've been exposed to it, but I didn't get it when either of them had it in my household. And so in some ways you think, well, yeah, you've been boosted twice now with people in your house that have had COVID. So it raises interesting questions. When do I get a vaccine booster? Because I've had natural boosting, on a couple different occasions. So anyway, these are the scenarios that are playing out and the questions that are being raised that are really difficult to answer.
So many questions. I know we had spoken about that the other day, like the timing of boosters is sort of being considered, right, depending on if you've been infected before. And then last question, gosh, I was just walking out on my break earlier today, and I always see these masks on, the ground. And I like to think that people accidentally, just left it there and didn't just throw it off and, be a litter bug. But sure, I'm tempted to pick them up and throw them out. Yes, no. Is there a way to do this right?
Yeah, I think pick it up if you're going to, and I do this myself, pick it up by the loop. And then ideally you've got some hand sanitizer. As soon as you throw it away, clean your hands. And that's probably the best way to handle that. If you have a tissue or something else that you can put as a barrier between your own skin and whatever it is you're grabbing to throw it away, certainly do that. But not everybody carries something like that in their pocket or their purse. But if you're gonna be a good Samaritan and throw away someone else's trash, just make sure you sanitize your hands right away.
Yeah. Okay. Well, that's good. I know it's our community. We need to take care of it. I like to think it was an accident. It blew away. Someone couldn't, they couldn't chase us down, and give the benefit of the doubt in terms of that. But okay,
there are a lot of people who, as soon as they can get outside of a building, that mask comes off, and sometimes it goes in their pocket, but sometimes it goes on the ground. So.
Yeah, it's sort of a defiance against this mask, right? Like it's a symbolic defiance.
Sometimes, yeah.
Dr. Doehring, always great to see you. Thank you so much.
It's good to be with you, Mary.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.